Occasional acid reflux is completely normal, but there's a difference between physiological reflux and pathological reflux, which is defined as gastroesophageal reflux disease. Today, we're going to talk about those differences and how GLP-1 medications may contribute to reflux symptoms. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I share a lot of my medical knowledge and experience on social media, on mostly TikTok and Instagram. And lately, I've seen a lot of questions about reflux. And if you have reflux, can you take a GLP-1 medication? What to do to mitigate those symptoms? And when to be concerned about reflux. So why is reflux starting? Or actually, let's start with what is acid reflux. So what do people mean when they say reflux or they're having heartburn? What's actually happening is the contents of the stomach are kind of pushed up into the esophagus, and it leads to symptoms. So the stomach is acidic, and it's acidic so that it can digest and process our food. And the stomach can handle that acidity. It's meant for that. But the esophagus, or commonly known as the food tube, when we swallow, that's what connects our mouth to our stomach, the esophagus. It does not have the capacity to handle that acidity. So if for some reason that acidic environment gets exposed to the esophagus, then it can cause symptoms. It can be uncomfortable, it can hurt. And over a period of time, actually people can get used to it and they don't have symptoms, and that can actually be a poor prognosis and cause issues. So acid reflux is not something that you want to ignore. It's something that you do want to manage. You want to find that underlying cause and treat it, and to have managed and monitored by a physician to make sure that there aren't, current complications or future complications. As I mentioned, everybody occasionally gets reflux. That is normal and not to be concerning. But if it is happening regularly and it's negatively impacting your quality of life, then that is classified as GERD, or gastric esophageal reflux disease, and that is something that needs to be managed. What are some of those underlying causes? So we can have increased pressure in our abdomen that is putting pressure on our stomach. So our stomach is a pouch, and if there's pressure being pushed on that pouch, then it can push up, physically push up those contents through the esophageal sphincter that typically is tight and keeps food in the stomach. It can push stomach contents up through that sphincter into the esophagus and cause reflux. So this can happen with people who have obesity. It can also happen commonly in pregnancy. So any woman that's been pregnant knows that obviously there is increased pressure in her abdomen, and they are more prone to having reflux during pregnancy. There can also be certain causes for relaxation of that esophageal sphincter. There are certain medications that can relax the sphincter. There are substances like alcohol and tobacco. Those things can relax the sphincter and make the stomach contents more readily go up to the esophagus and lead to reflux. There's also a condition called hiatal hernia, which is when there is kind of a defect in the diaphragm that typically keeps the stomach in the abdomen where it's supposed to be. But if there's a defect there, then part of the stomach can kind of protrude up onto the top of the diaphragm, and then that can make an environment where the stomach contents can really easily be pushed up into the esophagus and lead to reflux. So hiatal hernia is something that commonly leads to reflux. So why would GLP-1 medications worsen reflux? This is related to that slowing of the gastric emptying. And when food contents are sitting in the stomach for longer periods of time, then that is leading to that increased pressure and then can lead to new reflux or worsening of reflux if somebody already has it at baseline. It happens in about 5% of people who are on semaglutide or tirzepatide. And in studies, they saw that reflux was happening about 2 times more in patients who are on GLP-1 medications versus people who were on placebo. So it definitely increases your risk for reflux. But for most people, these reflux symptoms are transient and go away with continued use of your medication, as well as some dietary and lifestyle modifications that we will talk about. One interesting thing to note about GLP-1 medications, there seems to be an exaggeration of that delayed gastric emptying in short-acting GLP-1 medications. So the daily injectables like liraglutide, and then oral Wegovy, oral semaglutide will be more likely to lead to reflux because there is more exaggerated delayed gastric emptying compared to long-acting GLP-1 medications like injectable semaglutide or tirzepatide. So if you're somebody who is prone to reflux or you're really struggling with that side effect on a GLP-1 and you're on a short-acting version, then potentially switching to a long-acting may help to eliminate that side effect. I do want to highlight that although GLP-1 medications can increase your risk of reflux in the short term, it will decrease your risk of reflux in the long term because it is treating the disease of obesity. And when somebody is able to achieve and maintain a lower body weight, then they are less likely to have reflux altogether. So their GERD may be put into remission because they have less of that abdominal pressure that tends to lead to acid reflux. So if you are on a GLP-1 medication and you're experiencing reflux, or maybe you're not on a GLP-1 medication, there are some things that we can do to help mitigate your symptoms. For the people who are on GLP-1 medications, it is so important to start at the lowest dose and titrate slowly. I talk about this all the time because I see people who are struggling so much with side effects because either they are trying to push for fast titration for fast results, or their doctor is following a very regimented titration schedule and not titrating based off of your individual response. But it is really, really important to take titration slowly. Obesity is a chronic medical condition. It is something that we should treat and deserves treatment, but it is not an emergency. And so we can take our time with treatment, and we should. There is no reason to push that dose and make you feel sick and cause other problems. We should be taking it slowly based on your response. So if you're having reflux, I recommend staying at the dose that you're currently on until we can get your reflux symptoms under control. And then if we need to increase the dose for clinical benefit, then that would be the time to increase the dose. I am not a fan of fixed titration schedules for that reason. And then for anybody who is experiencing reflux, there are several lifestyle changes that you can implement to help control your symptoms. One of the most important things to do is to eat smaller meals. So the reason we want to do this is that large meals will put a lot of pressure inside the stomach. So it'll just fill up the stomach quite a bit, which will then make it more likely for that reflux to occur. So sticking to smaller meals, which may mean eating more frequently throughout the day, will help decrease reflux symptoms. You also want to avoid lying down right after eating. Also avoid bending over and picking something up. Anything that's going to increase that abdominal pressure, like doing crunches, is not a good idea after a meal if you're experiencing reflux. But then also laying down, because then you're inviting gravity to also put that pressure on the stomach that will cause those symptoms. So as much as possible, either staying seated or standing. Even walking can be helpful. For a period of time after eating, and that can be different from person to person. I would say at least an hour for general reflux, but for patients who are on GLP-1 medications, it may need to be longer, closer to 2 to 3 hours. And so the meal that is most commonly impacted by this is dinner. So this also encourages an earlier dinner, so your food can fully digest before you go to bed. But if you're not able to do that and you need to go to bed shortly after dinner, then propping yourself up with some pillows, or if you have an adjustable bed, will be beneficial to limit your symptoms throughout the night. There are certain foods that may exacerbate reflux symptoms. Fatty foods may exacerbate symptoms because fat will actually slow gastric emptying. So if you are having a high fat meal, especially in addition to a GLP-1 medication, then your stomach is going to empty even slower. And again, that'll increase chance of reflux. Really fibrous foods and high volume foods will also increase reflux. So avoiding fatty foods and high fiber foods, especially in the beginning of taking a GLP-1 and with dose titration, so when you first go up on your dose, will be helpful. That does not mean you can never have those foods. You can slowly incorporate them more as your body adjusts to your GLP-1 treatment. Especially fiber, we want to have a high fiber diet for our overall health. So I am not saying to avoid fiber. I am just saying to space out your fiber intake throughout the day for better tolerance. You also want to avoid acidic foods. And people often think of citrus fruits like oranges, lemons, but tomato-based products are a very common trigger for reflux. So red pasta sauces, pizza, salsa, are all very common triggers for reflux that we want to either avoid or just limit the amount that we're having if we are struggling with reflux. Or if you really enjoy those foods, then you want to pre-treat with medication, and I'll talk about those medications here shortly. Spicy foods can also trigger reflux. We also want to limit or eliminate alcohol, caffeine, and chocolate can also unfortunately be a trigger. Ensuring hydration throughout the day can also help offset reflux symptoms. So always important to ensure hydration. So if lifestyle and slow titration are not enough to control your symptoms, or you're having really bothersome symptoms, you can definitely consider medications, and we have several to choose from. The most commonly recommended and most effective are our PPI medications. So these are proton pump inhibitors, and they are either available over the counter or as a prescription. The prescription is just a little bit stronger if you have that need for the stronger dose, or you can get the medication over the counter. The most commonly prescribed PPI is omeprazole. And so that's the active ingredient that you would look for over the counter, or that your doctor would prescribe for you, the generic omeprazole. And there's a few others, but again, that's the most common one. This is a medication that you want to take 30 to 60 minutes prior to your meal. So as I said earlier, if you know that a certain food triggers your reflux, but you really enjoy it and you want to take it, then I would take your omeprazole a half hour to an hour prior to eating that meal, and that will really help to mitigate your symptoms. And this is something that some people take on a daily basis for many years, especially if there's really specific reasons to take this medication. Like I mentioned earlier, if someone does have GERD, chronic GERD, and potentially a hiatal hernia, then PPI long-term may be necessary to prevent the complications of chronic GERD. That being said, if that is not the case and you've been taking a PPI every day and a doctor has not told you to do that, then I would definitely check with your doctor and make sure that that is safe and appropriate, because there are some rare side effects of these medications, but real side effects that you would want to monitor for and make sure that the benefits outweigh the risks of those side effects. The next class of medications are H2 blockers, histamine blockers. And the one that I go to or recommend in this class is famotidine. This is also something that you can get over the counter or a prescription from your doctor. Same thing, that over the counter is just a little bit lower strength than the prescription. But these medications are a little bit safer for longer term use, but they tend to be a little bit more mild in their effectiveness, so can be great for mild to moderate acid reflux, can be used daily or also as needed for prevention prior to eating an acid producing meal. Many people also use Tums as needed over the counter, and that is also great to do. But if you are using those daily or on a regular basis, again, talk to your doctor, because there may be something that is more effective and safer to take long term. But that is excellent to keep on hand to use if if you had a meal that then led to reflux. Overall, I just want to emphasize the importance of communicating your symptoms to your doctor, because there can be specific changes that are recommended for you, whether that's your medications or lifestyle, or if you need further testing to determine why you're having this reflux and making sure you're not having those complications that I mentioned earlier. So communicate with your doctor as always. But I hope this overview of reflux, both in general and while on a GLP-1 medication, was helpful. If you did find it helpful, please share with somebody who is also struggling with reflux, so they may benefit from this knowledge. And I look forward to our conversation next week. Take care.